Hi, these are some simple drills to help you manage low back pain. So if you have low back pain and you're sort of over the severe stage and you're starting to recover, or you've been to your physio and you're just looking for some mobility drills to do to just break down any muscle tightness and introduce some movement, these exercises are perfect. They're the ones that I give to so many people in my clinic that I've made this video already for anybody with pelvic girdle pain during pregnancy, and now I'm just making this video for anybody else. So general low back pain, any stiffness that you can use. Okay, so we're going to come on to all fours. So great position for getting that full movement through your pelvis. So your knees are hip distance apart, and we're going to start by pelvic tilting. So you're tucking in your belly button, rounding your back right up towards the ceiling. Okay, and then you're arching your back down. So this is an interesting move. Some people will feel they're in an arched position, but if I'm watching, I might come along and find that there isn't a whole lot of movement going in the upper back, or we might find that there isn't a whole lot of movement going in the lower back. So make sure that you're moving through your lower back, but you're also getting that extension in your upper back. So your shoulder blades are moving towards each other and round up again. So the most common thing I see if anyone is struggling to extend is that the elbows start to move, that you feel like you're extending, but actually all that's happening is the elbows are bending and you're dropping. So if your elbows are straight, you get that extension through the whole spine. And if you want to add to it, you can look up. So round up, tucking in your belly button. That's it. Tuck in your tailbone and stretch through the shoulders. Arch down. So this should be pain-free. So if it isn't pain-free, it's the exercise to work on. And if by any chance this exercise aggravates your low back pain, stop doing it. It's probably time that you went back to pain management, spoke to your GP or your physio, or went back onto your anti-inflammatories, because it should be a nice recovery exercise. And arch down, also a prevention exercise. So if you've had any episodes of low back pain, this would be a nice series of exercises to use to prevent recurrence. Okay, and at this stage, we're not looking at strengthening, we're just looking at mobilizing. So if you've been to physio, they've probably done a lot of work to help to mobilize those muscles and get them in a better position. So your job at home then is to maintain that and to use it. Okay, sit back onto your heels, reaching far forwards with your arms as far as you can go. Drop your head, reach through your chest, bring your bottom right down to your heels and hold it there for 5, 4, 3, 2, 1. Walk your hands over to the right side, left hand overlapping right. So you're really getting that stretch through the side. Breathe in and out. Breathe in right down to the bottom of your chest and breathe out. Walk your hands over to the left side, right hand overlapping left. Take a breath in and breath out. Breathe in again and breath out. Good stuff. Back onto all fours. Pelvic tilt again. So round your back and arch. Round up, tuck in your belly button and arch. So again, those full ranges of movement all the way up, tuck in your belly button and drop down. Sit back onto your heels again. Stretch, stretch, stretch. Drop your chest, reaching forwards with your fingertips. Breathe in and out. Breathe in and out. Walk your hands over to the right side, left hand overlapping right. Breathe in and out. Breathe in again and out. Walk your hands over to the left side, right hand overlapping left. Breathe in and out. Breathe in and out. Perfect. We're just going to lie onto our back. So really we're repeating the same movement, but just pelvic tilting, lying on your back, hand onto your tummy and rolling back. So flattening your back, lifting your tailbone and then arching forward. So some people find it easier to connect with that pelvic tilt on all fours, and some people find it easier to connect with it lying on your back. So making sure you get that arch and then come back. Okay, come into your halfway position. Bring your heels and knees together. Bring your arms out wide and just roll your knees to the side and over to the other side. That's it. Roll to the other side again, all the way over and come back to the center. Come back into your halfway position. Pelvic tilt, roll back and forwards. Come into your halfway position. Okay, so you're in a pelvic neutral position. It's not the most important position in the world, but it's a nice position for activating your core. And before we do that, we're just going to breathe. So breathe in, feel your tummy rise. And breathe out. So a thing that we forget sometimes, particularly if we have pain, is how to breathe. Because when we get pain, our muscles start to brace and our breathing becomes more shallow. And what can often happen is that as we breathe in, we start to suck in. And as we breathe out, we try to release. So just connecting with your breathing. As you breathe in nice and relaxed, your tummy should rise. And breathe out. Hands on your ribs. Your ribs should move outwards a little bit as we breathe in. as the lungs fill with air and take up more space, and breathe out. So nice relaxed breathing. And just releasing out through your lower back, through your tummy, trying to get rid of any tension. Breathe in. And then just bringing on a little bit of core activation. As you breathe out, you're just going to draw up through your back passage like you're stopping yourself from breaking wind. And that'll switch on your deep tummy muscles, and then let it release. So remember, pelvic floor is a way of switching on the core, not just for women, but for men as well. And the most common mistake I do see, and a lot of people see, is that when we ask you to switch on the core, that the tummy just braces, that you just freeze through your center, hold your breath, and sort of hope for the best. But if you guide it from the pelvic floor, you're going to get a really nice switch on through the pelvic floor into your deep tummy muscles, and it's way, way more of a quality movement than freezing through your center. So breathe in, nice and relaxed, and breathe out, pull up, 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 and try to keep your core activated for 5, 4, 3, 2, 1, and let it go. So really important to feel that let go as well, because some low back pain is caused by weakness, other low back pain is caused by a lot of spasm and a lot of tightness. So really important to be able to connect with both the release and the squeeze. Breathe in and breathe out. Just pull up, 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 up for 5, 4, 3, 2, 1, and release. Bring your heels and knees together, arms wide. As I said, the emphasis in this first stage of low back pain recovery is just on movement, but just bringing in that little bit of awareness about core activation so you can build up that strength as your pain gets better. And really important to think about building up your strength so you can prevent any recurrence of your low back pain. Get that nice stretch. Perfect. Move your knees over towards your right shoulder and then over towards your left shoulder. Perfect. And just coming up onto your knees, sitting onto your heels, drop one arm down, side bend up and over. So again, really common muscle that gets tight, or a set of muscles that gets tight with an episode of low back pain are your side benders, so your quadratus lumborum and your lumbar spine muscles. Switch to the other side. So learning to lengthen and shorten all the muscles over to the side and back. Give your shoulders a nice little roll. Reach forwards between the shoulder blades, reaching up. That's it. Getting your elbows behind your ears, releasing the arms, and just doing a little bit of stretching. So reaching up towards the ceiling with one rib, then the other, and come back to the center. So that's it. Nice short session of exercise, but really, really valuable. I hope you found those good, and I hope they give you continued improvement. Thank you.